I can remember at some point saying to Matt Myers, who took over from Bill Novelli, would you consider your work done if there were no kids smoking? And at the time, vaping was picking up and vaping, and he'd say yes. And I said, but what happens if kids who generally must experiment to actually become full adults were merely turning to alcohol or marijuana or a wide range of other products, and that you'd cut off one set of psychoactive pleasures only to open the door on others, and maybe they'd be worse off? And the answer then was, that's not our brief. Our goal is simply to address the tobacco use of kids. I didn't have a chance to go further and say, well, what is the cost in terms of adults of an overfocus on kids? But I didn't have to wait long to get the answer, because when we had that extraordinary period when Scott Gottlieb and Mitch Zeller in 2017 wrote what I think is still the finest summary of where we need to go in terms of tobacco control, talking about the fact that we've got to close down the on-ramp into smoking, which they were talking about, let's not have kids start smoking or vaping, but let's make the off-ramp easier and more accessible to the adult smokers so that it would really save lives in the short and medium term. That referred to increasing tobacco harm reduction products, improving the quality of cessation products.